Well, the World Health Organization is now expressing concern over a new COVID-19 variant known as Mu. It was first identified in Colombia in January. Let's get more on this now. I'm joined by the Vice Chair at the SA Medical Association, Dr. Mvuyisi Mzukwa. Dr. Mzukwa, good evening to you, and thank you for your time. How different is the Mu variant from the other variants?
Well, good evening, Steve, and your viewers, and thanks for having us in your program. There is not much information that we have at the moment because this is a variant of interest that has been identified in the countries that you've mentioned earlier on. We know that what we should be looking for is its ability to be transmitted to others, the so-called transmissibility, also how severe it causes the disease, but also how it neutralizes the antibodies that have been developed by the previous infection or vaccines. So I think those are the three important points that we're looking for when we're talking about a variant of interest.
And I mean, as you say, the most worrying thing is revaccinating. I mean, we vaccinated many millions of people now against the variants that we know of. I imagine it's quite difficult. It takes quite a long time before you know if a new variant escapes that immunity. In other words, if the vaccines that we've used don't work against a new variant. It's not an easy sort of determination or finding to make.
Yes, Steve, that's so true, because that is why you know, the World Health Organization would always make a request to the member states to always be on a lookout in terms of the genome sequencing, surveillance and stuff like that, you know, to determine all these other things after that. Also to, you know, obviously the epidemiology around this variant, the new variant, so that that information is then fed back to the World Health Organization. You know, obviously not from one country, from many countries, so that you can have this data and make sense out of it.
I must ask you about whether or not you think the lockdown level is going to change, Dr. Mzukwa, as the SA Medical Association. A lot of speculation about this. I mean, what we do know is that the President is consulting on this issue. We also know that the number of new cases being reported every day is going down. We also know that there are variations. I mean, what's happening in KwaZulu-Natal is not the same as what's happening in the Western Cape, for example. Do you believe that it is time to lower the lockdown level to level 2 or maybe even level 1?
Well, Steve, I think it should not be a blanket approach. Like you've said already now, that KZN is still having serious problems in terms of having high numbers of new cases. So I do think that, you know, we might have to maybe think about keeping KZN to maybe not to the same level as other provinces. I think that should be considered. On top of that, yes, we can go down to lower levels, but also we need to guard against, you know, these very large gatherings that are super spreader events that normally would push us to the next wave. So I do think that we need to be careful so that we don't let our guards down when we go to the lower levels.
Well, I mean, this takes us straight to the elections, because there are some parties who are going to want to have big gatherings. We don't know what's going to happen. You're still very worried about large gatherings at this stage.
Yes, considering that also we're going to local government elections. You know, we need to be very careful of how we do, how we conduct ourselves as communities, as political parties, as religious organizations, as ordinary citizens of the country. Because if you have unnecessary parties and all these things, you know, and we've got huge numbers in funerals, I think that would definitely put us out of control in terms of going to the next wave. Because we still have lots of people who are unvaccinated.
Dr. Mvuyisi Mzukwa, Vice Chair of the SA Medical Association, really do appreciate the time. Thanks very much indeed.